So, welcome everyone. Hi, my name is Andrea Espinosa Carvajal, and welcome to the seminar series, Gender and Health, discussing socialism and transformation after the Second World War. This is the first of 4 sessions in which we will share ideas and explore women's experiences and gender-related systemic transformations in health culture, political participation, and state building. This feels like a good moment to start the series because we are commemorating International Women's Day tomorrow. So yay to that coincidence. The idea behind the seminar is to reflect on the role and spaces occupied by women after the Second World War. We want to consider questions like how the practice of expanding states' entitlement for women and families in socialist states resonated with the world, how those practices and discourses about women's rights and feminism intersected with race and class in what is now called the Global South, what happened with politics of care, reproduction, education, and political participation after the war. In a broad sense, these seminars will explore how political tensions contribute to the transformations of women's issues and women's political agendas around the world. This seminar is part of the work we are developing for the research project Connecting 3 Worlds, Socialism, Medicine, and Global Health after the Second World War. Today, to start our series, we have Professor Dora Vargha, one of the project's PIs and a historian of medicine, science, and technology with expertise in the history of epidemics, the politics of health, and Cold War history. Dora is currently based in the University of Exeter and Humboldt University in Berlin. She is also a visiting researcher at the Max Planck Institute for the History of Science in Berlin. Today, Dora will be reflecting on her research and highlighting some of the themes that we are discussing. Think about this as a broad conversation, and of course, questions are more than welcome after Dora finishes presenting her talk. As you could, I think you can see that in the screen, but we are recording this, so I hope everyone is okay with that. And if not, please send me a message. Thank you, Dora, for accepting to talk to us. And yeah, we can start.
Okay, first of all, yeah, thank you for the opportunity. And as Andrea said, this is part of a broader, the research group's work. And this seminar series is really Andrea's achievement, and I'm really excited to hear all the papers and contributions and to participate in the upcoming conversations in the series. We have a very exciting program, so thanks to Andrea for that. What I thought of doing is not to present a very particular detailed research paper, because I think that the most exciting things are upcoming as part of the seminar series, but to give a bit of an overview of things that I have been thinking about in terms of gender and health in socialism in the past, I'm not going to name how many years, and reflect on some things that have come up in my research, in my past research, and things I'm doing right now. So some of this, what I'll be talking about, is partly, published things that I'll try to draw together from various aspects of work I've done in the past on polio and epidemics, and then also part of it is very much work in progress, and I will be very happy to receive any kind of feedback or ideas, and really looking forward to the expertise, to having this wonderful expertise in the room. So let me get the technology working. And it's, of course, it didn't open at the beginning of the whole thing. Just one sec. Okay. So give me just one sec. All right. Can everybody see?
Yes.
Yes. Okay. So yeah, I'd like to talk a little bit first about the overall research project for those of you who might not be familiar with it, or for those of you who are very familiar with it and have heard me talk about this for a long time. Please accept my apologies, but it's to kind of frame, where our thinking is and what we've been doing. So Connecting Three Worlds is a collaborative research project that is funded by the Wellcome Trust. It's one of the last collaborative awards that the Wellcome had in their past schemes. And we developed this together with Sarah Marks from Birkbeck and Edna Suarez-Diaz from UNAM in Mexico. And the team is quite big. 5 postdoctoral fellows and a PhD student are currently on the project, and we have 6 collaborators working with us. And the 3 worlds that we are connecting are, can be understood in various ways. Of course, the most obvious one is the first, the second, and the third world. This Cold War framework that I'm sure you're all familiar with, and we're just using these terms as in the historical terms, contemporary terms. So we're trying to see socialist health not only in Eastern Europe, not only in the global South, but socialist medicine as in all its formulations in the West as well, from the NHS to Scandinavian welfare states, French initiatives, and so on, and all these networks, so they are part of it. Obviously, Eastern Europe, the state socialist countries is a strong focus, and another kind of 3 worlds that we're connecting is East Asia, Latin America, and Africa. So geographically, these are the 3 overlapping worlds, and kind of conceptually, it's also 3 different areas of research and how we can think about health. So we're bringing together into conversation areas of research that are usually quite separated from each other. So mental health, public health, and biomedical sciences. So this is kind of the nexus. And of course, we're constantly faced with a lot of questions and uncertainties because the object of our research is, keeps moving. It's a very sometimes very hard to pin down, where are the socialisms are happening, what kind of socialisms we are talking about. African socialisms, have a very different ideological and also practical approaches in practice than, for instance, Maoist China or Argentina, or Hungary for that matter. So we're trying to think about this, how it moves across geographies, but also through time. Disappearing socialisms, even in state socialist context, is changing throughout the decades. So it's a kind of elusive entity, and we're trying to pin it down, but not too much, to allow for this flexibility and still maintain an analytical usefulness for this. So what socialisms are we talking about, and how can we understand what socialist health is? So as I said, there's a fluctuation of regimes and practices, and there are also these very fleeting socialist structures that come and go over time, which we incorporate. So it's not only the very seemingly stable socialist, state socialist structures, or states that declare themselves as socialist in some iteration. We focus on socialist networks in this project, first and foremost. So how ideas and people move, what kind of connections are established. So we are looking at how people were actually connecting these various worlds and how they were establishing these connections. And of course, as I said, state socialism is a very strong part of it. So how can we think about socialist health and all its complexities if socialism isn't a given stable entity, and neither are, the places where it's happening or the time when it's happening? There is a kind of underlying commonality of of socialist health that we can see emerging, one of which is a focus on prophylaxis, so prevention is very important, and also to see health as part of a revolutionary project, as part of a political project. In its socialist ideas, health is always political and always very outright political. I mean, one could argue that, of course, health is political in every political structure, but this is very much stated and seen as such. So there's no seeming objectivity or neutrality of health in this regard. We use, as a group, we found it really useful to work with these kind of differentiations that Matt Savelli has laid out on his work in Yugoslavian psychiatry, and we've broadened those categories. So Matt has very usefully had been looking at, what makes something socialist in psychiatry in Yugoslavia, and he devised these two categories: socialist by default and socialist by design. And socialist by default is practices and structures and theories that have nothing really to do, or very little to do, with ideology. They're not underpinned by ideology, but they are they happen to happen in usually state socialist contexts. So socialist by default is something that, for instance, what I see in virologists working together, it's not necessarily ideology infused. Socialism as such doesn't really come into play. However, it really makes a difference in opening socialist networks to these actors, for instance. So that the science itself, the medical practice, the research, and or the healthcare models, they might not have be rooted in socialism, but because of existing socialist networks, politically underpinned networks, that is how people are moving around, and this is also their limitation occasionally, so unable to move around to the West, for instance, or have certain obstacles. Socialist by design, on the other hand, is on the other hand, is the ideologically infused version of this. So there is something about socialist ideology, socialist state structure, socialist political thought that infuses certain ways in which health is practiced, and that can also come out in research. So that would be, one of the things I've been looking at, which is not necessarily focusing on gender, is the differences in social medicine and socialist medicine. So what is particularly socialist in the way that health is imagined and healthcare is imagined in socialist states, as opposed to how it's done in countries and by proponents of social medicine on the West. and to try to understand if it's something different, or if we can think about it as a version of the same. And this is one of the questions I've been looking at lately. All right. So, once we open the box of, we no longer, know what socialism is, we also, have to look at what health is. And as I said, I think that if we are looking at socialist health and socialist medicine, we need to consider that there is something about the political in this, where whatever we're doing with it. Just sorry, just to go back, because that will be important in the upcoming discussions. Of course, Matt Savelli's, these two categories of Matt Savelli. So let me just go back to this. Matt Savelli's categories, we've kind of expanded it. Socialist by convenience is when some aspect of there is some particular health challenge that a society or a state sees, and is looking for models, looking for solutions. And there's this one particular way in which socialist states have tackled this. May that be either of those by default or by design, and they incorporate that one thing, or that limited amount of things, because it is convenient. It is not a state socialist structure. It is not a socialist government necessarily. There's no ideology in that, but it is convenient to take that on board. Okay. So thinking about gender and medicine, and this will not be incredibly groundbreaking. I just wanted to give an overview of some of the issues that come up, and that historians of medicine and health in the region particularly have been focusing on. So obviously, reproductive health and reproductive justice has been very has been central, partly because of the Eastern Europe's history, and beginning with the Soviet Union in the early 20th century as a kind of breaking the path for making abortion possible, and then fluctuating back and forth. But in the 1950s, there's a huge surge of abortion ban in Eastern Europe that is then, either lifted or not. It brings up all kinds of complications and very interesting histories, and very important histories that have huge effects and very important legacies. So notable is Romania's. Thank you. Notable is Romania's history of abortion ban that was very strict and extreme, and several historians have worked on it. Gail Klingman, and we all know these important and very well explored histories. There is also, there's much more to discuss and discover. Access to contraception, bringing in histories of pharmaceutical production and biomedicine into the picture. Thinking about population politics and ideas about the socialist society. Of course, part of this is has harrowing stories of forced sterilizations. Czechoslovakia is one of the most well-known part of it, which is very much infused with ideas of race, which comes into it. So these are overlapping categories, ideas about what the state socialist or the socialist body is, and who gets to be part of it, who is how it is this population is engineered. what I found, in these histories very inspiring is to incorporate, to think about reproduction, to think about population politics, because they underpin so much of what is going on in Eastern Europe, particularly on the areas where I work on, because they have such an impact on wider society. So I would, and as many people do, you can incorporate history of childhood into this, history of disability into it, and see, what kind of how they affect and how they impact mother and child health, which is central to socialist ways of thinking, and to prophylaxis, how they affect care for families. I'm thinking here about these figures of on the border of social care and healthcare. For instance, in Hungary, the védőnő, who is still this very important person in Hungarian healthcare, who will come. It's a health visitor basically, but not exactly. It doesn't really map onto the Western health visitor, who is very much involved through health into what a family should look like, how people need to raise the citizens the right way, and that also, as many scholars have explored, also connects up with shifting welfare policies, and that have very interesting and important effects on discrimination, partly on race and partly on class. So the connection of poverty and the ability to raise children. So that's in my mind, that the reproductive health is, of course, and now especially incredibly important as things are taking very interesting and sometimes horrifying turns in terms of access to abortion and contraception all over the world. But they, if we look at histories of socialism through this lens, through reproduction, it kind of opens a new lens to a lot of areas of social history, political history, and cultural history. And that brings me to talk a bit about the body. Of course, one wonderful work, again, has been done on sex and sexuality and socialism in Eastern Europe and beyond. And I'm sorry if I'm mostly speaking to Eastern Europe at this point, but this is where I'm coming from to it. And this affects also medical knowledge production and the non-normative body. So how health is conceptualized from anatomical descriptions of the body to medical research, whose body is the normative body, and how do women and non-male people fit into that, and how is that tackled? And here we can see, very conservative and very defaulting into very well-known histories. And the question is there something else going on in socialism, in societies, and in ideas, and where at least on a theoretical level, women are kind of liberated in ideal terms. It brings us also to the idealized body. We're all familiar with the representations of the worker and what socialist citizens should look like. And this also has a huge and wonderful literature on the Soviet Union, on Eastern Europe. And this is also, tying in with the population politics, tying in with reproductive practices of what is the aim here to build the new man and woman and to build this new society, and how that fits in with bodies that do not conform to this. I've mentioned race and a new, very exciting kind of a recent literature has begun to explore whiteness in socialism, partly, notably, James Mark has been working on this recently, and that also, that is an incredibly important aspect to look at, not only within societies, may that be indigenous populations in outside of Europe, or Roma populations within state socialist countries, but also ideas of race about within these societies, and how that then maps onto and intersects with gender. And this obviously has a great importance as socialism goes global and as international networks, women activists, but also people, socialists on the move, are engaging with each other. So it is an incredible, important part of it, partly because of the medical knowledge that is being developed in these encounters. So we had here in Berlin, Bogdan Jakob recently talking about Romanian tropical medicine, and one of the key points is the how the ideas about the other socialists are working with knowledge produced by state socialist professionals, medical professionals, who are engaging this in a very stated, anti-colonial and decolonizing way. So it gets very complicated very quickly, and incredibly important to understand these limits of brotherhood and sisterhood, and but also what it might open up and how we might see these interactions in different ways. And finally, another very important area of research that I think relates to an important part of socialist medicine and gender is women in science and medicine. So this, and I will talk a bit about this in the following through my own research. So obviously professional hierarchies come to play very similarly to overall histories of medicine, but sometimes with a twist, and I will talk about this in a little bit. There is, what are the opportunities that socialist ideas provide for these professional hierarchies to be challenged or to work out in different ways? What are the limits to it? And obviously, and there's another big set of literature on this, women's networks and movements, international women's associations that have existed within socialist, among socialists, within the socialist world, and also globally as well. So it brings us to this kind of history of internationalism literature. Of course, one of the, if we think about health as practiced, one of the first and foremost and most important, very visible parts of this is healthcare, and emphasizing the care in this regard. Women, of course, and as elsewhere in the medical professions, are the main actors who are providing care within the home and within medical settings. And it's very important, I think, to dig into this deeper. And, many of you who are sitting here in this virtual room have done exactly that on a national and also on an international level. It's also a very important part to look at the expertise of women and how that changes, how that develops, and how that engages with the socialist structures and also socialist ideas. And women, of course, as experts, as medical experts, become international agents, and these are the two things I'd like to talk a bit more about. I just need to check, sorry, the time. Okay. So I don't want to take, too much because this is just kind of an overview of the many things that come up and that we can discuss in the seminar series. And I hope that we can go ahead and talk more about it. So I'd like to bring here the work that I've done on care in polio hospitals in Hungary, and particularly this Heinemeden hospital that was opened in 1956, 57 officially, and was in operation until 63 when it was turned into a general children's hospital. And this hospital was established actually in the papers were first signed during the 1956 revolution in Hungary, and it was in the Buda Hills in a very affluent area, and it recognized the special need that children with polio who are disabled and need constant care and medical interventions need. So there were several hospitals across the country. This was one of the biggest ones, but there were others in Budapest where polio patients, children mostly congregated. And what is very interesting about this hospital is that it really, because the care needed for the children was so specific and so intensive, a number of the nurses and medical staff lived on the premises, and the children were spending months and sometimes years in these institutions. So these functioned as micro societies. Basically, they were getting education, they were getting operated here, they had their rehabilitation period here, and basically lived their life. And you can see a couple of pictures. All the photos in this presentation are from Fortepan, which is I mean, most of the photos which is an open source photograph archive online in Hungary. What I found very interesting is that through this hospital, it was possible to really get a look into the everyday life. So this is very much kind of a history from below to try and understand, how society worked, and especially medical society worked in the 1950s, when it was still quite under formation. I mean, the 1950s in Hungary was really, really, there was a lot going on politically, from an early Stalinist period to a revolution, to retributions, and kind of an appeasement period with a very shaky international position throughout. And what became clear is partly because of several issues. One was the question of medical authority. So, as one would expect, surgeons were men, and nurses were women in the hospital. They also had a high number of male medical staff, auxiliaries, who were in charge mostly of carrying children around. As they grew bigger, they were more difficult to carry. Now, the particularities of polio made it required highly trained physical therapists to help with the rehabilitation. So surgery alone was not enough and was often not the right choice to be able to help these children be mobile again and provide treatment for polio. And so one side of this story is a rising set of medical profession, which was dominated by women. So physical therapists became, and they still are, primarily women who had medical degrees, and they received, it was a very new profession at the time, so they received their training as well through care. And physical therapy became so important that I found instances where they were able to overrule decisions of surgeons. So they could tell surgeons not to operate when surgeons wanted to operate, and the surgeons were very dependent on the physical therapist. They had to work together. So that created that kind of really messed with established hierarchies that were really, really ingrained still in the 50s. And that was possible for these women, partly because of polio, but partly I found, instances, very public reflections and also more private reflections on how women were using actually the rhetoric, the political rhetoric that, well, you said that we're equal, so this is what we're going to do. We're going to use that. We're going to use the words, the concepts of the political arguments of the state socialist government and kind of turn it against them and fight for our rights through that, and to take them in earnest. And that was also a way for women to achieve things that they might not have been able to otherwise. So it was a very interesting way of, at the same time, being isolated from the rest of society through this physically, as well as in this rather privileged part of the world, but and having the hospital had its own dynamic, not much affected by the outside political world, but using that to achieve professional authority and to improve conditions, improve the nurse lodgings, and improve conditions of working. So that is one aspect that I found important. Another one is the treatment itself, and if you look at existing work, for instance, mainly in the United States, by disability historians on polio treatment, and how it was very much tied with military ideas and masculinity, and how that undermined ultimately polio. People living with polio in later parts of life, when their condition deteriorated due to post-polio syndrome, where polio kind of comes back later in life. I did not really see this happening. What was important in this, so that kind of militant and that kind of masculine approach to rehabilitation and to disability was not so apparent in this context. What was apparent is what I mentioned earlier: the representations of the body, of what a citizen should look like, and how and what kind of productive work they should be doing, affected greatly the way that these children were treated and the options that they were presented for later life or professions, for instance. And that idea also affected very much the treatment options that doctors pursued. And finally, the main reason why this dedicated hospital was established, why there were quite a lot of funds, I mean relatively quite a lot of funds going into this, was because this all happened, the disease that was making children disabled happened at a time when population policy was going the exact other way. So children were becoming disabled when the priority was to have a lot of healthy workers and to grow the population that was decimated by war, and that was really focused on industrial production. So it kind of all hangs together, the ideas of body, women in medical profession, and also reproductive policies. And this is something, and I'm going to not go on for much longer, but I wanted to bring you this. This is something that I'm working on currently. I'm looking at medical teams that are going from Hungary to various different countries, currently North Korea, Mozambique and Algeria, but I'm starting to look into Libya and Yemen as well. Obviously, this research has a lot of limitations. Currently, I'm unable to go and conduct research in North Korea. Even collaborative research is not possible. I have been able to take a quick look at archives in Mozambique. I'm still trying to understand first the Hungarian side and follow-up leads, but I'm also developing a collaborative research in Madagascar, which also had a socialist government in the 1980s. So what struck me, and I know that we're going to be talking a lot about women on the move in the next couple of months, but I've been, as part of these medical missions, I've been finding women or reflections on women. So interestingly, the sources that are produced by the actors themselves, what I found were overwhelmingly written by men, but I've began to spot women, and also reflections on how these women, the kind of situations they found themselves in and how they dealt with them. And I'm still trying to find follow-up leads. So in the North Korean case, what became very clear is the important one of the most important actors that emerged, and this is a very recent find, because I have not seen her anywhere mentioned anywhere, but it turns out that she's very influential in coordinating everything and in navigating political terrains and intervening into medical teams, is a kind of secretary at the embassy in the Hungarian embassy in North Korea during the Korean War. So medical missions were sent from Hungary to North Korea from 1950 to 57, every year a new one, but the embassy staff did not change every year. This woman was the constant person, because consuls also changed and other people working at the embassy changed, but she was the kind of trusted, but also she was the one who kept a lot of it together, and yeah, kind of this background worker who really engaged in very much detail and attentive detail with the medical missions. So there are women who are not necessarily so visible, and we don't know that much of them. Women were, of course, part of the medical teams as well. They went mostly as nurses, but some of them were sorry, some of them were doctors who were part of these medical missions. And one of the things that they were doing is training women from villages to be nurses. So there was very little medical infrastructure in North Korea, and this was seen as part of they reflected it on this very consciously of how the Japanese rule left no medical infrastructure. There are no medically trained personnel, and this is something that they need to do in order to ensure that the society survives, not just the war, but in general, and to tackle health challenges. So one of the key elements was the training of nurses in these hospitals that were field hospitals at the same time. So this is all happening during a war, which is quite astonishing. And I'm trying to find out more about this, of how, the role of women, of North Korean women, in creating the North Korean health infrastructure, and also, what the dynamics were of that training. And lastly, I'd like to just highlight this psychiatrist that you can see one of the documents from her travels from the Ministry of Health, and trying to follow her up, because she's quite a fascinating character. She spent 4 years, 2 years in Mozambique as head of psychiatry in the largest hospital in Maputo. And then she asked for a transfer to Algeria, and she spoke both French and Portuguese. I still need to look into, how and why she she spoke Portuguese, and where that, what that backstory is for her travels, where she joined actually her twin sister, who was also a physician and was already working in Algeria. And this is a very interesting, it's intriguing to me to see, what moves socialist interventions, the agents of socialist internationalism, what are the motivations, and how they fit with or do not fit with ideas of, what Hungary is doing, for instance, in sending these women, sending these doctors, among them women, to socialist countries in the third world, and how they, their personal story and their personal motivation and thinking, fits in with that, but also how they fit in with the environment and the context that they're going to. And what is that relation? In Algeria, I would, that it's not, this seems to be a very kind of almost heroic case of this woman in her 40s who's, going and doing the doing, and she's traveling the world and really staying for quite a while in these places. But you can see, how gender comes into a lot of these programs. One of the sources that I found was that they were sending a woman, a doctor, back to Hungary from Algeria, because she established a relationship with an Algerian man. They moved in together, and that was totally that was not permissible. Interestingly and unsurprisingly, you do not find any kind of these complaints or scandals about men being involved with local women. Hungarians, for instance, in North Korea, married, got together with North Korean women. They even got married. Absolutely no problem there. But when women transgress, that is a totally different different issue. And of course, we know these from historians of women and gender who have worked in colonial contexts, how these ideas of race and masculinity are interconnected, and the threatening masculinity of the other is plays out differently. So this was kind of the rambling introduction that I planned for today, and this is just a quick introduction to the wonderful papers that will come in the seminar.
Thank you, Dora. That was really, really interesting. And as you said, like a really good way of opening this conversation. It was really fantastic because I was writing my questions while you were speaking, and you answered most of my questions. So I want the audience to start maybe with some of the things that you want to know a little bit more, or that you want to explore with Dora.
Just on a side note, I'm sorry, as an illustration of women and gender in, academia and science, if you will, and care work. While I was giving this talk, one of my kids came in and deposited a bubble tea on my on my desk. But this is how it's happening. It's like that is also a part of it that we haven't discussed so much, the kind of intersection of the home care work and medicine and medical care.
Yeah, that's true. That's care. Well done. You're also being very, you're cared for. I think we have a hand raised, Siobhan.
Thank you so much, Dora, for such a brilliant paper. I thoroughly enjoyed it. I've got two questions, if I may. The first is about these medical missions that are sent from Hungary to different parts of the socialist world. I wanted to ask about the reception of female medical professionals in some of the countries that you mentioned. Are there any clashes in ideas about gender, the sort of official socialist ideology, and the reception in different countries? I ask because I'm currently working on Soviet Red Cross medical missions to different parts of the socialist world. And the fact that the vast majority of the mission are female doctors often causes problems with local populations. And when the Soviets collaborate with international organizations like the League of Red Cross Societies, they're asked to only send men because in some countries, patients refuse to receive care from female doctors. So that's my first question. And my second question is a little broader, perhaps. Do you see any examples of this dominance of women in medical fields within the socialist world having an impact on the prestige of specific branches of medicine or healthcare? I ask because I saw Susan Grant on the call, and she's covered this in her excellent book on nursing in the Soviet Union. So I was wondering if this is something you've seen in your own research or with other people's research on the project. And thank you again. It was a really, really interesting talk.
Thanks. I think, yeah, the reception question is so crucial, and I have, because I'm just doing the research now, I have no answer for you, but I would love to have further conversations about like what we can see happening at in different aspects. I think that what I see is I think in the 70s, 80s, I haven't yet seen any rejections because of gender, but I haven't seen, all the papers yet. So I'm in the process of collecting. What has come up is the inability sometimes for male doctors to reach women patients in certain North African countries, for instance. And that is where this comes up, where you need women doctors because they're the only ones who are able to treat women or to meet women but it's I think it's also very much infused with ideas of these other less developed societies that have not, you know, reached this kind of modern biomedical enlightenment. I think that part of it is one thing that is going on that I'm curious how gender plays out in is the making of certain societies into biomedical citizens. So there, you know, part of these medical missions are partly this kind of civilizing missions of bringing biomedicine and making biomedical subjects out of the people who do not necessarily know how to behave in a hospital, or that they need to stay there. You know, they need to like be taught the rules of engagement. But yeah, in the North Korean case, I mean, and it also changes with time. In the 1950s, there is a lot of talk about respect and how people talk to each other and to the Korean counterparts and even within the teams, and that is something I'm still trying to understand. There are pushbacks against it in some ways when and then taking for granted these hierarchies. What I think is important to think about is not only the women, but the question of masculinity that always that comes up in these missions away from home, and especially in contexts where there is violence or there is war. There's always there's this interesting intersection of socialism and masculinity that I think comes out in these medical missions. So no answer. Basically, the second question, the prestige of these professions. Absolutely, it is you know, huge literature again on this. I'm not. I mean, for instance, if we look at the question of the physical therapist with the decline of the disease, so it's really, you know, what historians of technology and have also written about with the decline of the urgency of polio, for instance, physical therapy's prestige kind of goes down because it's not so urgent and not in crisis mode anymore. And that you know, there are these different theories of how the medical profession, especially medical professions, and certain procedures lose their prestige once women enter and once women take over. In this case, it loses prestige once it's not because of the women, it's because of the urgency and the importance in this aspect. So it can work in different ways. I'm not sure what the connection to socialism is there in that sense, other than creating the space for the prestige to be there in the first place. So very good questions and not that many answers, I'm afraid.
No, great answers. Thank you. Thank you very much.
Thank you. Julia, you have your hand up.
Hi, can you hear me? I'm very sorry, there is some background white noise, but I will speak. Oh, okay. Dora, thank you so much for the talk. I have a very specific question, only confined to Hungary, and it is my curiosity if in your research you found any materials that would explain the predominance of male gynecologists in today's Hungary. I just listened to a feminist podcast in Hungarian this morning. I tried to do it to keep my Hungarian at a kind of decent level, and they raised this issue that many, well, anecdotally, the podcast hosts, the journalists found that it's a problem for many women in Hungary to find a female gynecologist. And I would imagine that this tradition, of course, of this male dominant medical profession, even in the sphere of gynecology, has roots in state socialism. It's late socialism, and I wonder if you would probably be able to comment on it. And if it's recognized as a problem, or is it seen as a problem in Hungary today?
Thank you. That's an excellent, excellent question. I have no answer to it, but what I can say is that there was an active engagement with getting women to be in the medical profession. So already from the early 50s, it was a clear directive from the Ministry of Health that the women need to enter the medical profession because it's dominated by men, and this is not permissible in a socialist society, and this was very much ideologically infused. My guess would be one thing that they could not ever do is, the main argument was that everything is so much better now because everybody has access to healthcare, and we're providing that for free. And so very relatively quickly, they incorporated everyone into the health insurance system, and that everybody should have access to public, healthcare. Yet, doctors continued to have private practices on the side, and they were using public venues to do that private practice. And that not even Rákosi and the strictest Stalinist times could do anything about. That was they couldn't touch doctors about this because they were needed too much. And that continued well into the 90s. And my educated guess would be that it's male dominated because there was a lot of money involved, and it was a highly prestigious thing. So the obstetricians, gynecologists, mostly the obstetrician part, that's where the big money was. And so men were very much present and motivated to do that. So in line with the usual arguments of the feminization and prestige of medical professions, this is very much prestigious and big money. So apart from the surgeons, this gynecologists, obstetricians were who were raking in the big money, and that was unbroken through the 90s until now.
Thank you, Dora, for that. Susan, you have your hand up as well.
Yes, I'll lower it. Thank you, Dora, for that really interesting presentation. So I have a question that I realize is more socialism than gender. So I loved all your photographs in the presentation. And when you were talking about the polio hospital in Buda on Buda Hills, I was looking at the photographs of the children, and I was wondering, who are these children? Are they children from elite families? And I was wondering if you could talk about, if this kind of microhistory, is it representative of, say, care for disabled children more generally at that time?
Yeah, thank you. Yeah, that's a very interesting part of it, because this kind of acute care and rehabilitation, so the medical care part of it, was very much across the board. So in these hospitals, you could find the party secretary's kids and really poor day laborers' kids who tragically, some of these children got stuck in these hospitals and never went back to their families because the families couldn't afford to take care of them. So they were kind of, acted as depositories in this way, but everybody was there together. And later the longer term care was I think where it really separated. So the children who were coming from very poor families, or families that maybe had a lot of children and couldn't care for them, or did not want to care for them for some reason, they were then collected and they were put into this state care. And that they were just bounced around in abandoned, villas and castles and stately homes and wherever they could put them across the country, without access to any more medical care, even if they needed to. And once they were put into a psychiatric hospital, and so that I talked to some of these people and totally traumatized the children, because they were in the same space and on same corridors with psychiatric patients that were locked up and were sometimes violent. And you can imagine what the circumstances were. And so this kind of grouping together of disability and kind of that kind of depositing and putting it out of sight was very much there. But it was very striking to me that this hospital in particularly was such a kind of microcosm that was partly representative of how socialism was imagined, but not exactly not how it worked outside of and super interestingly, a lot of the women who were working there were nuns before, so because they disbanded these Catholic, the orders that were doing the care work, they kind of incorporated them, and some of these people were recounting that, and then they came in at night and secretly taught us to pray. So they were kind of and then there were also like some tensions also within that. So you can see a lot of things playing out very interestingly in this setting.
Thank you.
Okay, that was really good, and it was I didn't know the idea of nuns, carers, nurses. That connection is quite interesting if we think about who provides care.
And and it's interesting because the same word is used for sister is used for nuns and also for nurses. So they kind of even remained in their in their name the same. But that was a very interesting dynamic there.
Yeah, that's very, very interesting. So do we have any more questions or comments that you want to share with us? If not, I will use my power to ask one question about, like, one of the things that comes across every time we discuss women in the history of medicine or the history of science or women's experience is the lack of materials. And I found very interesting just where you were discussing how even the history of these women are not necessarily told by women. So you don't find the primary source of the women, but the doctors talking about, but the general overview of the thing talking about women. How do you find that place in the way we understand the dynamics of the time? And how we can move around these type of situations.
Yeah, I think that post-colonial literature is the way to go to find ways to see what's not written about, and that I mean, I found obviously if people are still living, oral histories are a good way to go, but I think while it's limiting of what one can find out, I think especially in from what I can see in Hungarian sources, is that there was space for women to address certain things publicly, if they use that kind of, if they engage with that ideology and used that, weapon. So there is, you find women in newspapers, doctors who are saying, well, look, I'm kind of doing much more than the men, and they're the ones complaining, because I'm also doing the home care work, and I'm caring for the patients, and and I'm making dinner, and so on and so forth, and this is not right, and this, something needs to be done about this. And there was a way to talk about this, and through these complaints you can kind of work back of what the everyday experiences were. But it's I'm also unsure if it's because people in power were still tended to be more men, or they had the time to leave these memoirs or writings behind, because women had other things to do as well. I'm not sure what, where that imbalance of the sources lie, or it's just a question of preserving the sources, because they were not deemed important enough to be archived or to be survive the regular archival purges. I have no answer. I can only guess of what the challenges, the reasons for the challenges are. I don't know if that was your question or not.
I was muted. No, yeah, you answered my question, and it also, like, your comment made me think about like how to, in the operational level, maybe there was not so much information because of whatever the context was. But however, at the political level, in a more public situation, as you mentioned, the narrative is different. And I have seen that also through looking at the media, but at the same time, not necessarily looking at what was happening in the ground as a description. Except that women come across a lot in photos, in photographies, right?
Yeah.
Photos and images are very good for distribution.
There was a wonderful very small art project in the History of Medicine Museum in Hungary, a photo album by Viola Fatio, who took photographs from the 1950s from magazines and public representations of women doctors with children. So of women doctors, what she found when she was looking for women doctors was women doctors with babies. That was, and what she did was she put one of these photographs, and she placed a religious painting of the Madonna and Child next to it, and they were exactly the same iconography, exactly the same. And so it's, that's really, really carried through. But then, I find in newspapers descriptions of doctors going all across the world, and a lot of times it's women, and they're telling us of their experiences. A lot of times they're pediatricians, of course, which comes back to that kind of medical hierarchy question that Siobhan was alluding to, I think. So, but there was a lot of need for pediatricians. So
I wonder if there was also power in invisibility. So power in the ability of movement without being, I don't know, if that idea of the system is not necessarily wanting to pay too much attention to women, if there is also a little of extra freedom and flexibility in that. Yes, Sebastian.
Well, just one, if you can give me 1 second, Sebastian. I think that would be a really worthwhile thing to think about and engage with a bit more of this kind of using that flying under the radar thing to in the movement and and getting to places and doing the doing. And you can see that in like the early modern histories of women in science, collecting specimens and traveling the world, and they're really flying below the radar. Of course, these are very privileged women coming from privileged families, but they manage to do all this in various ways because they have that flexibility of not being taken so seriously sometimes.
Yes, Sebastian, you might be the last question of the evening.
Great. I hope it's a good one. Thanks, Dora, for the really stimulating talk. I was just kind of pondering a bit about the what you mentioned, the biomedical subject and the creation of that, and basically the role that women had also around it. Now, you did bring up very interesting cases of, for instance, physical therapists becoming this thing that was emerging mainly around women, and if you will, the genderization of labor. Now, something else that happened parallel in the 1950s and 60s was the use of local women for outreach of healthcare centers, for instance. So we're working. I'm working right now in community health, and that was one of the main features that you see recurrently for two purposes. Firstly, to teach rural populations about what the hygienic ways of living life is, and the second thing is also to collect information to, in a way, document what was happening on the ground. So as a result, if you follow that line of work, what you have is the origins of community health workers, of rural nurses, and then of nurses. And in fact, many people, women in the rural areas, kind of joined the route of community health workers precisely for the purposes of reaching that goal of becoming a nurse. Now, I'm speaking from the Latin American side. The question is, to what extent you've also found this, for instance, in the case of polio in Hungary, or maybe some other archives that you've encountered in all these places that you've looked at, maybe Mozambique or Algeria or something, that also points to the fact that actually gendered, even though it was, as you mentioned, there was a need of women becoming doctors, when that didn't happen, maybe it sidelined into, okay, let's just have other professionals, other professions that women can take in to replace it. I don't know if that dynamic exists, or maybe it's just something very peculiar of what we've encountered in Latin America.
I think that's what's partly happening in North Korea. That the women, this is an employment opportunity for the women in villages that is not agriculture. So that is possibly especially because these are close to villages, other than factory work later on. I think this is one of the ways to get engaged in this. I mean, the kind of women's role in this collection of data and also reaching out and engaging with local communities. I mean, you can see this already in religious organizations in colonial contexts, right? These missionaries that are doing this, and it's a lot of times women who are doing this kind of work and who are recruited to into these ventures. So I'm not sure if this is something specific to these socialist contexts. I think maybe what the difference would be that kind of community engagement, which I don't, it works differently from what I see in Hungary. And, we've talked about this many times, that this is very much like the community engagement is also very much top-down, hierarchical, part of the hierarchy and the biomedical. So the idea is not to have people like lay people involved, but the health centers are also medically trained people who are fitting into that hierarchy. And this Védőnő is that some Hungarian women are now doing research on, and I can't wait to find out more, because it's I've also always was fascinated by it. Also, I encountered them, throughout my life, and they're supposed to be these intermediaries, and they're all women, and they do this kind of care work, but they're also doing surveillance work, health surveillance work, and ever so often there are some scandals even now where something was not spotted in time, and why didn't this health worker report it when something happens to children? Why didn't they pick up on this? And this is partly this is I think a complicated and very, very interesting history. Why these people would become, choose this profession, that I have very little information on, or even ideas. But there is there is in Hungary, for instance, there is the health cater training happens on the secondary school level. So it's also that it's folded in, and that's always and still is populated mostly by women. So that's it. It's not kind of nursing school, but it's like a health high school, and that's and that already gives you some kind of qualification.
Thank you for that, Dora, and thank you for the time and for the presentation. I think I can talk for everyone. We enjoy this a lot, and I think we can finish there.
I'd just like to add that I can't wait to learn, from from the upcoming talks and presentations, because I think there's so much wonderful research out there, and yeah, thank you for putting this together and organizing it and giving us the opportunity to talk about this.
Yeah, I'm happy about that, and the reception of this. And yes, in 2 weeks, so for the 21, we have the second seminar, and of course you can have the link through the Eventbrite, but with the Welcome Center we are going to still be circulating this in social media, so everyone is welcome to be part of the seminars. Bye, have a nice
Thank you very much.
afternoon.
Thanks. Bye.
Bye bye. Thank you all.